The topic today is ADHD, Attention Deficit Hyperactivity Disorder, symptoms, treatments, and benefits. I want to start off some of the symptoms. Very often, personally, it has two aspects to it. One is inattention, and the other is hyperactivity, impulsivity. So ADHD, the hyperactive. Now, if you have ADD, this attention deficit disorder, you don't have the hyperactivity. But when we talk about ADHD, which then has the hyperactivity and impulsivity and the inattention, and ability to stay focused on a task for a while. And we're going to go into what those symptoms are. To have a diagnosis of ADHD or ADD, it has to be diagnosed before the age of 7. So it's something that begins in childhood. Sometimes the symptoms are reduced with time, and sometimes they're not. You have adults with ADHD. And one of the dangers of ADHD in terms of the inattention, hyperactivity, impulsivity, one of the dangers is that it could lead to oppositional defiant disorder. In oppositional defiant disorder, what a child who has ADHD, what they hear from everybody is, shh, don't stop. Shh, don't stop. Because people feel out of control. Their world's being totally disrupted. So the message is stop, don't do this, don't do this, don't do this. Now I'm going to give a good rule of thumb right now. Because children with ADHD hear so much criticism, and very often people, the parents even, might end up not even liking their own children because of it. And so we're going to talk about how that has to be offset. They might love their child but not like them. So there's 2 pointers I'm going to point out right to begin with. One is a 2-to-1 rule. For every criticism, every time we say stop, don't do that, you did this, then you have to give two praises. But you did this right and you did that right. That's good. That's a good job. Well done. Try to give 2-to-1, because eventually they develop low self-esteem and they feel like they're a screw up, they're doing everything wrong. So you try to go 2 things to praise. And it takes an effort because you're upset. The child was impulsive, just took something and broke it, a very expensive vase or whatever. And you have to then be able to deal with that upsetness. And always is this. You have to say the child is more important than the vase. I mean, the vase is very important, but the child's even more important. So you want to be sure to give 2 things to praise, and as well as saying, gee, you did this thing, you know, it's a problem. Now, one of the benefits that very often parents get is they get detached from their material possessions. A lot of times the people feel so out of control, it drives them closer to God. It's one of the benefits. And also they get detached. They realize whatever they have can be destroyed. This child is running around. If they treasure anything too much, it could be gone. So you really get to see close up. You can't count on any of these physical treasures remaining intact. So on one hand, it's a tremendous liability. On the other hand, it gets you detached from the material world. So that's some of the benefits, is because people do feel so out of control, especially once the child, if they develop ODD, oppositional defiant disorder. What happens is after a while they go, everything I do is wrong, so tell the child to stand up, to sit down. You say go right, they'll go left. And the big problem happens is the child will not receive guidance from the parent. So you might give the best advice in the world, but the child will actually go the other direction. So actually you can force the child actually into really destructive behaviors by keep advising them to be constructive. Oh, you want me to be constructive? You want to be nice to someone? So, all right, boom. So that can happen. Now, one of the theories about it I'm going to go into in terms of biological analysis, it's known to have a genetic, organic basis to it. And there have been a number of findings that trigger this inattention, that trigger the hyperactivity, the impulsivity. And by the way, the inattention will show up in many things. They don't show close attention to details. They're careless, make mistakes. They don't complete tasks. They look like they're not listening. There's a frequent shifts of topics and activities from one to the other. They don't complete the projects. It's hard for them to organize. The materials they might have materials to do a certain task and they can't find the materials. And they're easily distracted. You know, a plane goes by, they're in the middle of this thing, oh, there's the plane, and they're going off on something else.